Hey there, welcome back. My name is Jodi Scholes. I'm your instructor for the MBLEx review course, and it is time to talk about medicine. Yes, there will be questions about medications on your MBLEx exam. My experience has been there's no more than 3 questions. However, I'm going to give you some of the most popular medications in the United States right now. And if they show up on your test, well, then bonus, you've heard about them. If you can't remember, then you can't remember. You're not going to get every question right. But I wanted to cover some of those classes of medication with you. Ready to go? And here we go. Welcome back. I'm glad you're here. So what do we need to know? Let's start off with some of the most common medicines in the United States. Here are 7 of them. Some of them you've heard of before. Lysinopril is where we're going to start. So Lysinopril, Lysinopril. It's a medication that is an ACE inhibitor. So it is not a blood thinner, it is an ACE inhibitor. It is often prescribed for people who have high blood pressure. Another word for high blood pressure is hypertension. Hypertension and high blood pressure are the same. So about half of all adults in the United States live with the diagnosis of high blood pressure. That's according to the CDC, the Centers of Disease Control. However, some choose not to take medication. Medications that are ACE inhibitors relax the blood vessels, and that prevents the narrowing of those blood vessels. It just makes it easier for your heart to pump blood. It is not a blood thinner. But Lysinopril is the generic name of this medication. Its brand name is also listed here, which we'll talk about in a moment. But because this is generic, it's inexpensive, and it's been used a lot. It's been prescribed widely for over the last 20 years. The brand name, so the fancy name for Lysinopril is Zestril. Now, other than memorizing, how can you remember the name of this medication? I've come up with a little something for you. But before I talk about that, this ACE inhibitor medications like Lysinopril are treated for not only hypertension, but also these other conditions. ACE inhibitors are typically for high blood pressure. These are other examples of ACE inhibitors, but notice Lysinopril. So Lysinopril all have this pril, right? Except the brand names Zestril, but pril comes up. So here's my new and improved way to remember Lysinopril. So pril or trill, I think of famous Phils. Okay, famous Phils. All right, so Phil Collins, Poxitani Phil. Who's a famous Phil that you know? Think of them in your mind's eye. Imagine them holding a card, a playing card that's an ace. So Phil Collins with the Ace of Hearts. I got Poxitani Phil here from the movie Groundhog's Day. Actually, not even from the movie, from Groundhog's Day. Every February 2nd, Poxitani Phil comes out and lets us know if it's going to be 6 more weeks of winter or spring is near. So, but just think about these with an ace, the ace of from a deck of cards. That will help you to remember Prill, famous Phil, ace. So Phil Collins with an ace. Prill, Phil, ace. All right, it's helped me. Maybe it'll help you. Next common medication here in the United States, and that would be Synthroid. Don't even know how to say those other things. Synthroid. That is the brand name of the generic drug, and it is for the thyroid. It is for hypothyroidism. So you can see here, this is an image of the thyroid right here in the picture on below. The thyroid is a lovely butterfly-shaped gland, and it helps, this drug, Synthroid, helps to bring that the thyroid hormones into balance. 5 out of every 100 people in the US, some men, mostly women, have issues with the thyroid. But you see the spelling of the word looks like thyroid. Great way to remember it. So for hypothyroidism, controlling the levels of the thyroid. Amoxicillin. Amoxicillin's been around for a long time. You may have even been prescribed amoxicillin. Amoxicillin is used as an antibiotic. It is an antibiotic. It's in the penicillin class. But amoxicillin, it's used to treat things like strep throat and other things that can be treated with antibiotics. But antibiotics are used to treat bacterial infections. Antibiotics, bacterial infection. Antibiotics, bacterial infection. Yes. And it's amazing. Antibiotics have been revolutionary as far as their treatment in the United States and all over the world. However, unfortunately, patients who are sick with viral infections also sometimes expect to be treated with some type of medicine. Viral infections are not responsive to antibiotics. Amoxicillin does not treat viral infections. So it has been estimated by the Centers of Disease Control that 1 out of every 3 prescriptions for antibiotics is actually going to be ineffective or, worst case, unnecessary. Why is that the worst case scenario? Because when we take medicine that we don't need, our body can develop a resistance to it. This is the difference again between bacterial infections and viral infections. Recently, we went through COVID-19. That was a viral infection. So why it was kind of scary, because there were really no drugs that could treat it. The virus just has to run its course. And so when we use antibiotics, when we overuse antibiotics, it can lead to our body developing antimicrobial resistance. It changes the flora and fauna in our digestive tract. And when we really need those antibiotics, we may not respond as well. So awareness of this antibiotic, growing a resistance to antibiotics, doctors are becoming more aware of this situation. They used to just prescribe antibiotics just because sometimes patients were very aggressive. They said, what type of medicine? I need medicine. I'm sick. Well, you don't always need medicine when you're sick. Sometimes you do if it's bacterial. But with this viral infection, sometimes doctors would just give patients penicillin or amoxicillin or some type of antibiotic just to have something to treat them. But physicians are actually becoming more aware of that now and not prescribing unnecessary medication. That's good. Next medication that we'll want to know, ibuprofen. This is Motrin, this is aspirin. Ibuprofen, actually it's different than aspirin, but they are all under the classification of the NSAID, NSAIDs. So you might have even reached for an ibuprofen in your life sometime. These non-steroidal anti-inflammatory drugs, NSAIDs, help to reduce pain and inflammation. They are used for treating pain. Treats headaches, joint swelling, a variety of other condition. But sometimes aspirin is used not for pain, but for anti-inflammatory to reduce the risk of heart attack or stroke. Um, Ibuprofen has less of an effect on blood cells and platelets, so it is not used. Ibuprofen is not used to prevent heart attacks and strokes. Aspirin is, but they are both considered NSAIDs. Ibuprofen, brand name Motrin, probably sounds familiar. All right, another medication, number 5 in our lineup of common medications in the United States and actually beyond, Adderall. So Adderall is used to treat ADHD. It contains 2 drugs, amphetamine and dextroamphetamine. It's a class of medications called stimulants. It's used often, more often than we like, than in school-aged kids to help with concentration. You have Adderall, and then you have Ritalin as well. Both are stimulants, and both are used to treat ADHD. This medicine is used to help help with restlessness. Kids that are just jerky, jittery. Back in the day, we used to call it ants in your pants. And now they're finding that this drug can help to improve concentration. It treats the central nervous system. This drug is also used to help with narcolepsy, which is falling asleep. So that's the other end of the spectrum, right? So you've got the restlessness and then you have falling asleep. But Adderall is something that you may see on the MBLEx. It's also something you may see as a prescription with clients in your treatment room. Let's move along to Xanax. Alprazolam, so most commonly known as Xanax. So alprazolam, it began to circulate for anti-anxiety. And Xanax, mostly if your clients are taking Xanax, they have some level of anxiety. Xanax is also considered a benzodiazepine. Gotta get that right. Benzodiazepine. And that's not always good. Benzos are not always good for long-term treatment. So should people be taking a Xanax every day? Should people be taking any medicine every day? Well, some medicines, yeah, right? Diabetes medicine and whatnot. But certainly addressing the anxiety is part of the reason they are on your table. Now, it is not good to go cold turkey off of Xanax because your clients can experience withdrawals. So to cut back is better than to go cold turkey. But if you see Xanax on your MBLEx, you will know that it is there to treat anxiety. So benzodiazepine, and so benzos treat not only anxiety, but also insomnia, some seizures, some people who have epilepsy, and certainly if the anxiety is bad as that they have panic disorder, then you may see your client on some type of benzo. Yes, so benzodiazepine. But in general, benzos are used to treat anxiety. So if you see that on your MBLEx, you'll know that's in the, I like to use benzo like bingo. Like, did you ever the song B-I-N-G-O, 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 and bingo was his name, oh. Song about a dog, bingo, yeah. So benzo, B-E-N-Z-O, B-E-N-Z-O, B-E-N-Z-O is treatment for anxiety, oh. Yeah, so benzo, bingo, anxiety. So if you had a dog, you might have a dog that is a treatment dog, dog for anxiety, dog for a mental health dog. The name is escaping me. Sorry, all you dog lovers. I do know this. In any case, a comfort dog, one that you can take on the plane. So imagine the comfort dog is named Bingo, Benzo. Maybe your dog's name is Benzo. So maybe you have a dog instead of Benzo. Again, different ways to try and remember these random names of medication, some of which you'll need to know on the MBLEx. So again, please lower the dose, work with your doctor. If you're on Xanax and you're ready to come off, work with your doctor to slow down rather than go cold turkey. Also, massage can certainly help a client who's coming off of Xanax and maybe experiencing irregular levels of anxiety. Massage therapy can help to calm the central nervous system, reducing the feelings of anxiety. All right, our last one, yay, Lipitor. And you'll see statin. So Lipitor is a statin in the atorvastatin. That's the generic name. But Lipitor is what we see most often. That's a very common brand name of the statin. And so this is when people have high cholesterol. So before it leads to a buildup of cholesterol in the arteries, doctors will often proactively put a person on a statin. I don't love that idea. I don't love the idea of somebody having a stroke either. But it seems that once people hit the age of 65, the doctors want to put them on a statin. And statins have side effects, which we'll talk about in a moment. But the way Lipitor works is it blocks the enzyme in the liver that makes cholesterol. So other options are to adjust the diet. So doctors will advise their patients to start a nutritious diet and then take your statin. Could it be that a healthy diet might help? Could we try a healthy diet first? Are the clients going to be compliant with a healthy diet? But it is easier to take a pill. What are the reasons people get Lipitor? If it is a child aged 10 to 17 who has genetically high form of cholesterol. So some people are born with high cholesterol. It actually, if they're born with high cholesterol, is less likely to be a problem. Just saying. Some people just have naturally high levels of cholesterol. It's not from diet. It's not from lack of exercise. And it's not necessarily a problem. But if you see a child on Lipitor, it's because their heredity has given them high cholesterol. Likewise, the doctors are trying to lower triglycerides in people with high triglyceride levels. And then, of course, that will lower the risk of heart attack or stroke, and especially with people who, in addition to having high cholesterol, have type 2 diabetes. Remember, there are two types of diabetes. Type 1, we're born with. Type 2 is adult onset, so the result of lifestyle choices. So sometimes Lipitor is the double down, type 2 diabetes and high cholesterol. It can lower the risk of heart attack and stroke for people with type 2. But again, could we address diet? Could we address some lifestyle changes? We could. But what doctors have found is that patients are often not willing to make those changes. Some of the side effects of Lipitor, people can feel sluggish. They can get a headache. The voice can be hoarse, lower back pain or side pain. Sometimes tenderness around the eyes or cheekbones. Sometimes there's difficulty going to the bathroom, peeing. and sometimes a runny nose, stuffy or runny nose. There is a book out about how Lipitor can also contribute to memory loss if used for longer periods of time. I will leave that to your discretion to decide. But also, once on Lipitor, if you see this on your MBLEx, don't drink grapefruit juice on Lipitor. Have you heard that? Yeah, not good. Can cause all sorts of bad things to happen. So avoid eating foods with high fat because it can make Lipitor less effective. Alcohol with Lipitor can increase your risk of liver damage, but mostly just avoid grapefruit juice. So, have you been studying? Yeah. Does it seem like like you're like one of these students where you've got all these books open to figure out, oh my God, what's happening? What's happening with this with drugs? How am I going to be able to remember them all? You don't need to remember them all. You don't need to memorize all these drugs because in practice, my friends, in practice, you will not be looking up drugs. You won't have to memorize them. Either your client will tell you why they're on a drug, or you'll look it up. Yeah, it's the benefit of a health intake sheet. And let me remind you, every client needs a health intake sheet. This is way beyond the MBLEx. The MBLEx will expect you to use a health intake sheet with every client. And so will I. Why? Because we want to know what medicine they're on. Some people come with a printout. Sometimes I work with elderly clients, and they literally come with a printout of the medications they're on. Do I need to know all that? It's good for me to know because of contraindications and because of side effects. Also, because of session adaptations. So we've covered medications today, and in another segment, we'll cover session adaptations as they relate to your client's assessment, reassessment, and treatment planning. But for today, we're just covering those medications. And these are the 7 I want you to be familiar with. Please use the best use of your time and the best use of your brain by only being familiar with these medications. Very soon, you are going to hit what I call the tipping point, where all of a sudden you're like, wait a minute, I know this. Wait a minute, I know this. You're about to take a pathology quiz, and you may find that you're like, oh my goodness, I know this. Oh my goodness, that's good. And so that is when your learning turns into knowledge. And when your knowledge grows, there's a tipping point where you're ready. You're ready to take the MBLEx. Yeah. And this segment of your learning, this part of your learning, contributes to that tipping point. And it also contributes to your calm confidence of knowing what you know and being okay with what you don't know. Very soon, you probably have already graduated from massage school. If not, well, good for you that you're being proactive in preparing for your MBLEx. But most of you have already graduated from massage school. You've taken lots of tests. You probably haven't taken a 2-hour computer test, but that's why you're here. You've got a ton of knowledge. You already are building on all of this knowledge. Yeah, and very soon, after you've graduated from your massage school program, now that you've been a graduate maybe for some time, you are ready to pass. You are ready to take your MBLEx and envision that word passed on the piece of paper that you are handed at the end of your testing experience. You will see pass. And then you will be eligible to submit that passing test score for license in your state. Yeah, becoming a licensed massage therapist. Some of you will be certified, some of you will be registered, but many of you will be a licensed massage therapist. that's what I have for you today. So thank you so much for spending this time with me, for being curious about medications, about taking the time to learn some of these most common medications in the United States in a way that will serve you when you take your MBLEx. So, best of luck. Good luck with the quiz. Have fun with it. All right. See you again real soon.